Hello, everyone. It's Dr. Marty Ross here. So we're having another one of our conversations with Marty Ross MD tonight. You may notice a little bit of a different setting here. I'm actually in my camper van, driving back from Denver, back down to Austin, and I'm somewhere in a place called Clayton, New Mexico right now, near the border going into the panhandle of Texas. So it looks like I should have pretty good internet connection here. At least my phone says I've got 5 bars, and so I'm using that as a hotspot. So hopefully everything goes okay. So as usual, I am creating a recording tonight's webinar, and tomorrow morning, hopefully by 9:30 in the morning, I have it posted up and in the Zoom recordings area on at Lyme United. So to find that, you're going to look over on the left-hand navigation menu, and you'll see Zoom recordings. That's where you're going to go ahead and look at it. Okay. And then in terms of the way these webinars work, I'd like you to write your questions to me using the chat box. And then I prefer that you don't do cross chat within the chat box because I use it mainly just to see your questions. Okay. So if you start clouding it with a bunch of cross chat with each other, then I have a hard time following the questions. All right. So I just ask during this type of an event that we do it that way. And then the other thing, some of you may notice, I've been muting your microphone. So make sure you leave your microphone muted unless I ask you questions directly, all right? And so one of the nice things about this format of using a Zoom room setup is that I do have the ability, if I need to get some clarification from you, to actually ask you questions. And so I may ask you follow-up questions. And if I do, I'll please unmute yourself so that I can talk with you. And my preference is if you're in a situation where we can see you, I would like you to turn your video camera on while we do that as well too, although I understand sometimes that doesn't work the best for everyone here, okay? All right. So without any further ado, I think we'll go ahead and get started here. I know we still have people coming in. We got about 70 people signed up for tonight. Usually I get about anywhere from about half of that up to about 50. So we'll see how many people show up here this evening. All right. All right. So first question is from Colleen. Hello, Colleen. Number one, is it okay to have magnesium, fresh ginger, lemon juice, apple cider vinegar, or birch xylitol during the prolonged 5-day fast or during the non-eating hours of a 16 to 18 intermittent fast? Okay. So there's a distinction I want to make. There's a difference in what happens with a 16-hour off, 8-hour eating period fasting, intermittent fasting, and prolonged fasting mimicking diet of prolonged. All right. So the thing that you're trying to do with the prolonged diet is to have a certain mix of amino acids, proteins, and fat that are preset in these kits that they send you. And it's designed somewhere around 700, 800 calories a day, but it's the mix of calories, the fats, the sugars, and the protein, amino acids that are designed to trick your body into thinking it's still fasting. All right. So in a fasting mimicking diet, your body is in a full fasting state for those 5 days. And that's because it's being tricked into it. While you still get a little bit of nutrients so you feel better, but it's being tricked into not seeing that food in a sense. All right. Versus on a 16 to 18 intermittent fast. And what that usually means is you don't eat anything for 16 hours and you eat all your food in 8 hours. Your body is not technically tricked into a prolonged fast. All right. And it's during the prolonged fasting that you start getting some of the processes like autophagy, which is a cellular cleanup process where cells clean up and repair damaged parts. That does not start taking place in that 16 hours without food, but it does in a prolonged fast, okay? And then one of the other big things that happens in a prolonged fast is you get rid of what are known as senescent cells, or cells that have stopped dividing. And when cells stop dividing, they go into this arrested state that they're called zombie cells. And being a zombie cell, they produce tons of inflammatory chemicals. And those inflammatory chemicals influence the other cells around them, leading to even more inflammation, all right? Now, historically, we thought senescence was something that happened as a cell aged. There was a certain number of times that we thought a cell could divide. But we now know that stressful events and high oxidation events like having chronic infections can trigger these cells to go into arrest, leading to increased senescent cells, which promotes some of this inflammation that we're seeing. All right. So in a fasting mimicking diet, prolonged fast, you actually get good senolytic activity and you get good autophagy. All right. All right. In a 16 to 18 intermittent fast, you're not getting the senolytics and you're not really getting much of any autophagy. All right. So I just need to make a distinction there. Right. Now, what a 16 to 18 diet is good for is weight loss. You still can get into weight loss because often when people are doing a 16 to 18 fast, they're actually calorie restricted in a sense, because usually during that 8-hour period, you're not eating the same amount of calories you might if you spread it throughout the day. The other thing it seems to be good for is diabetes management. And so you get some metabolic management that comes out of a 16 to 18 intermittent fast, but you're really not getting the benefits, the anti-aging benefits that also can be beneficial for people with Lyme with increased autophagy and increased senolytic activity. Okay. All right. So the trick is the things you're having, you don't want it to override the tricking that we're trying to do the fasting mimicking diet. All right. So I would think ginger is going to have probably some caloric amount. I don't know how much. Lemon juice is going to have some calories in it. The cider vinegar probably have some calories in it. The xylitol, I don't think is going to be counted as a calorie, but those things I would not do on a prolonged 5-day fast. In terms of your 16 to 18 fast, again, the predominant role of that is really more about calorie restriction. I don't see a lot of calories being in your ginger, lemon juice, apple cider, and birch xylitol. I think you could do those on a 16 to 18, even during the period when you're not eating on that. Okay. All right. All right. Secondly, let's see. I've been doing intermittent fasting for about 2 weeks, eating during an 8-hour window, 1 p.m. to 9 p.m., and fasting for the next 16 hours each day. Are you a fan of this idea in general or specifically for someone with energy issues, meaning they crash after very small amounts of activity? I seem to have been doing relatively okay with the intermittent fasting so far as I can tell. So again, intermittent fasting, I think, can be very powerful for getting metabolic control, lowering cholesterol, helping with diabetes management, maybe even decreasing inflammation to a degree. And the other thing is it leads to some caloric restriction, which all can be good things. All right. Again, you're not getting the same full benefit that you're getting out of that 5-day fasting mimicking diet, though. Okay. All right. I hope I answered your question there. Colleen, did I answer your question adequately for you there?
Yes, you totally did. And you explained that really, really well with the prolonged diet.
Yeah.
Was taking fast notes. And then just a FYI, the reason I am doing the intermittent fasting is because I'm a little nervous about the jumping into the prolonged fast. And a friend of mine suggested, well, why don't you do intermittent fasting? You get a little bit used to it, and then you could jump in.
I think there's something valid to that. I mean, I will tell you, your hardest day of the prolonged fasting mimicking diet is day 1. And it's because your body is getting, especially if you've been a coffee drinker, that first day is when you go through all your withdrawal at the same time, and your body is starting to slow down and get used to a calorie restriction. Now, the thing is, on that first day, I think it's 1,000 calories you still get. It's the second through 5th day that you're in that 700 to 800 calorie restricted range. But the idea of going through a period of time without food and getting used to what that feels like, yeah, I think you could get a good feel of that and kind of train yourself, be ready for it by doing a 16 to 18 or a 16-8. So how I do on a regular basis, I do a 16 to 8. And I have found that beneficial in terms of bringing down weight. Because of a bunch of shoulder problems I had, I couldn't hit the gym for about a year, and then I had some other problems. And so I put on more than I wanted to. And I have found, though, I got some weight loss out of doing the 5-day fasting mimicking diet. But then it continues because the 16 to 18 is actually a calorie restriction diet as well, too.
That sounds awesome.
Yeah.
Thank you.
Yeah, you're welcome. Does anyone else have questions about those things that we were just talking about? Let's see here. Doesn't look like it. Okay, we'll move on here. All right, let's see. Emily, let's see. Hello, Dr. Ross. What are your best practices for avoiding constipation and allowing detox while treating with herbals? I'm currently prescribed pain medication, but I worry I will have complications with that detox pathway bogged down. I have tried over-the-counter products and they help, but not much. Thank you. Okay. So Emily raises a great point, and that is having regular bowel movements is one way you get toxins out. All right. So your liver is your main organ that detoxes fat-based substances. And in the liver, when a fat-based substance hits the liver, it's transformed into a water-based substance, except for mold toxins. The liver doesn't do a good job with that. But most fat-based toxins in the liver are transformed into a water-soluble toxin by having this water-soluble chemical group added to the toxin, all right? And then they go out into the intestines, and if they're water-soluble, if we're pooping regularly enough and quickly enough, they get pooped out. If you get slow transit, though, what happens, meaning constipation, what happens is some of the bacteria that line the intestinal tract can break off those water-soluble chemicals, and suddenly these fat-based toxins that your liver has tried to fix, so they're water-soluble and get mixed in our poop, we poop them out. That doesn't happen as readily because the water chemical groups get eaten off by some of the bacteria, right? So it is a good idea to have one bowel movement, maybe two bowel movements a day. Probably one's fine. Okay. Now, the problem you're talking about is if you are on pain medications, especially if they're narcotic pain medications, sometimes the anti-seizure pain medicines that we use, sometimes antidepressant medicines we use to manage pain, those things can lead to constipation. All right. So there's some standard steps. Number one, make sure you're drinking plenty of water, and that means probably about probably the maximum amount you want to do is 1 ounce per body weight a day per pound. Okay, that's one way you could do it. If you're 150, did I just do that right? Forget that. Just make it somewhere around 4 to 6 8-ounce glasses of water a day. Okay. All right. Number two, so you need to put enough liquid in to keep things mushy. All right. Number two, you want to try to eat primarily a plant-based diet or a plant-forward diet, meaning you can still have animal protein, but keep in mind if you're having a plant-forward diet where you're getting whole fruits and vegetables, not vegetable juices, not fruit juices, but whole fruits and vegetables, whole grains, they have fiber in them. And that fiber will stimulate the muscles in your intestines to contract. Okay. So that's the foundation. Eat a lot of plants if you can, and then drink plenty of water. Okay. All right. Then, if that's not working well enough, the next thing you can do is add in magnesium. Now, magnesium, basically, whenever you have magnesium, the particles of magnesium attract water into the intestines. They also keep water that you drink in the intestines as well, too. All right. So there's this phenomenon in medicine which is called oncotic pressure, which is wherever there's a bunch of particles, water likes to go there. All right. So that means water within your blood vessels as part of blood. If there's a lot of particles sitting in the intestines, that water will get pulled into the intestines. Likewise, if you have water in your intestines, because there's all these particles at oncotic pressure, it's going to hold more water in there. Okay. So you could do magnesium at nighttime, and somewhere in a range of about 300, 600 milligrams is often enough to loosen stools. If that's not enough, you could add another 300 milligrams in the morning. Your limiting factor with magnesium is it can make you sleepy. That's why I have people take it at nighttime. And then you also want to make sure you're using a form that stays more readily in the intestines. So, for instance, I would not use magnesium glycinate. Glycinate tends not to lead to the water retention in the intestines the way that magnesium citrate or magnesium malate might. Okay. So, for instance, at my store, I carry both magnesium glycinate and I carry magnesium product called magnesium citramate by Thorne. That magnesium citramate is a combination of magnesium malate and magnesium citrate, and that can be very good at getting you to sleep and making your stools mushy. All right. Now, the reason I carry magnesium glycinate is sometimes people don't want mushy stools, so magnesium glycinate I carry because it tends not to lead to that mushiness. Okay. All right, now if you're doing plant forward diet, drinking lots of water, and you're on magnesium, you're still constipated, my next step is to add in vitamin C. So I don't think many of you may know that, but there's something called bowel tolerance with oral vitamin C. And that is at a certain point, vitamin C will lead to mushy stools. All right. And we call that bowel tolerance. Yet usually is somewhere around 6,000 milligrams or 1,000 milligram vitamin C tablets up to about 10. That usually somewhere in that range, it's going to be making your stools mushy, and you can continue your magnesium and then add that in, and through the additive effect, that often is what's going to get people going. Okay. So that's kind of my basic program. And there's other things you can do, but my basic program is drink lots of water, try to eat a plant forward diet, and then add in magnesium first. If that doesn't work well enough, then start putting vitamin C in up to 10,000 milligrams. When you're using your vitamin C, try to get a buffered variety, so which means it's not as acidic, so you're not going to get an upset stomach from that. Okay, all right. So Emily, did you have any other questions about that?
No, you talked very thoroughly and intelligently about poop. Thank you
Okay.
so much.
That's my goal, is to talk intelligently about poop.
No, I've been following your webinars since about the time I got sick.
Yeah.
9, 8, 10 years ago. So I just wanted to say I appreciate you.
Thank you. I appreciate that too. All right, good. I'm glad we were able to help you with that, Emily.
Thank you.
All right, let's see here. Next up, let's see, we got one from Jim. Hi, Jim. Let's see. Thanks for these great webinars. You're welcome. I've been diagnosed with frozen shoulder, and it appears that it is at least partly caused by infection, probably Bartonella, maybe Borrelia, and others also. When I take things like methylene blue, diflucan, and black walnut, I often get stripe rashes around the left shoulder and increased pain. I'm looking for guidance on what to do. Should I stop treatment entirely and wait until it gets fully better? Or should I keep taking Bartonella killers at a level where it doesn't cause the pain to be too much? Any other guidance would be appreciated. So yeah, that's an interesting question. So probably what's happening with your Bartonella killing antimicrobials, meaning the methylene blue and the diflucan and even the black walnut, is you're getting a localized Herxheimer reaction, which is as you're killing the germs in that area, the immune system sees those dead bug parts and is releasing more cytokines. So you're probably getting more inflammation and pain in that area. That's what it sounds like to me. So I think it's okay. I wouldn't stop. I mean, I would still keep treating, but you might want to find a level that's tolerable for you, meaning an amount of medications, killers you're taking that don't trigger so much increased pain. And it's about your own tolerance levels there. Jim, did you have any other? Does that answer it for you?
Yeah, that's kind of how I've been playing it. I've been sort of taking like 1 drop of Lutinia a day, and once a week I'll take diflucan and black walnut once a week, and that's kind of where. I mean, does that sound like too little, or?
No, I mean, you know, what is the right dose is what works, and if you're getting a Herx, is working.
Yeah. Any other thoughts on? Because
Well,
I think with frozen shoulders, it can last for like a year or more. So
it can take a bit to quiet down. I mean, we talked. I think maybe the last webinar we had, maybe about 2 weeks ago, I think we brought this up, and I suggested looking at doing, or maybe it was in one of the office hours, but I would look at getting some acupuncture for that. It really can make a big difference. And then the other thing is one of our other participants had mentioned possibly getting a prolotherapy for that. And so prolo would involve injecting into that area either saline, meaning salt water, or sometimes they'll inject lidocaine. Neither one of those are going to cause a problem with suppressing your immune system. So don't do steroids, because steroids will suppress the immune system in that area and allow the Bartonella to grow. But you can, what prolotherapy does is you inject something, whether it's saline or you do lidocaine, and that injection process leads to temporary increase in inflammation, but that attracts red blood vessels in that try to help heal all of the inflammation then, basically. So that could be a way for you to go as well too.
Great.
Oh,
Yep.
the other thing you might want to look at, though I'm thinking about it, is red light therapy.
Okay, good. Because I was thinking of that.
Yeah.
I have never done it before, but
yeah. It's really got some, I've been reading on it. I haven't tried it before, but it really does have some good benefits at reducing inflammation, especially for athletic events. I mean, it's got some good data on it about its ability to decrease inflammation and help healing it. Even, I believe it promotes healthy mitochondrial function as well too.
do you know of any devices or anything?
I don't, to be honest with you. Actually, no, there's a company that makes, as I've looked, I'm sorry, I have been looking into it. I'm blanking there for a minute. I believe there's a company called Juul,
Okay.
Juul, I believe, that has a fairly good product from what I can tell. It seems like a solid device and has got good reviews on it as well, too.
The last question that came to mind was with the various Bartonella killers out there, are there any that tend to work pretty well but don't cause herxes? Are less likely to cause herxes?
So what I have found is if you're going to herx on one, you'll probably herx on another.
Okay.
So yeah, so I can't say, and it's all very individual. So no, I don't have one that might do better for you than another.
Okay, that's great. Thanks so much.
All right, good luck to you, Jim.
Thanks.
Does anyone else have any comments for Jim or ideas for Jim?
Hi, Dr. Ross.
Lisa.
Yeah. There. I just wanted to mention that I have purchased 2 of the LightPath LED red light machines, and they're fantastic, and they're on sale right now.
Okay, what's that company name again?
LightPath LED.
Okay, there you go, Jim. Real time advice. Thanks, Lisa. I appreciate that. All right. All right. Hello, Sandy. Hi, Dr. Ross. Do you find homeopathics work for Bartonella? Have you used them in conjunction with herbals, etc.? Okay. So I need to make a distinction because sometimes when people use the word homeopathy, they don't really mean homeopathy. I think you do from the way you just wrote that. But so homeopathy does not mean herbal medicine. I just want to say that. Okay. What homeopathy is we give you a substance that if we gave it to you at a full dose, undiluted, it should cause your problems, all right? But in homeopathy, that substance that we give you is diluted multiple times to the point that there probably aren't any molecules of that substance left. And what you're getting is the energetic imprint of that substance, all right? All right. So it's energy medicine. And for some people, it can have profound effects, not everyone. I would not use it as a germ killer. I don't think it's an effective germ killer. I do think homeopathy in some people can give you good symptom relief and maybe even beneficial at getting decreasing inflammation. I think the best way to do homeopathy is to work with a homeopath, and I would say a traditional homeopath. So the thing about homeopathy is it's not as simple as saying you take arnica for inflammation or you take, which there is a homeopathy called arnica, but when you're talking these complex situations like in chronic Lyme disease, you need a homeopathy, homeopathic solution that's developed for you. All right. So what a traditional homeopath will do is they'll sit and they'll talk to you, probably a good hour and a half, 2 hours. And what they're trying to learn is about you, your psychology, how you react to things, how does your digestive system work, a whole bunch of stuff that they then use. They study you and they pull out their compendiums, or these days they use their computer, and they put in all this stuff about you. And it says, this person should be on Natmer or whatever it is. Okay. So it's very much an individualized type of treatment. I will tell you, I've used homeopathy before for some of my situations, and it all depended on who got the homeopath. There were some homeopaths that got me, and I got decent solutions for whatever I was going in for. And the one I was using in Seattle actually moved, and I got a replacement, and we could never get something to hit the same way. So some of it is really an art form. But yeah, I think it's something that can complement and can be helpful with symptoms. I would not use it as a germ killer, though. Okay. Sandy, does that answer your question for you?
Yes, it does. Thank you.
All right. Good luck to you.
Thanks.
Hello, Damien. Let's see. I've been taking herbs to manage Lyme, and the doctor decided to add in minocycline to boost Borrelia killing. However, when I did this, I started getting BART skin conditions like striae and boils, as well as babesia symptoms like sweat and air hunger. Can increasing antibiotics trigger these other bugs to become active? I'm so sensitive to treatment that I'm afraid to go after all those bugs at once. Any thoughts? Should I taper down to a lower dose of the minnow or change the prescription? All right. So minocycline is a tetracycline in the same family as doxycycline. It is, in theory, it is more fat soluble, and things that are more fat soluble have an easier time getting into the brain. Okay. The reality is, though, clinically, I don't see a distinction. And minocycline, because it is so fat, I don't see a distinction in the effect. Okay, let me put it that way. The only thing is I sometimes steer away from minocycline because there's about 5% of the time it concentrates so heavily around the nerves in the brain, it becomes an irritant. And that can lead to tremors and shakes, sometimes can lead to depression. So about 5% of people can't take it for those reasons. That doesn't mean that would be you or anyone that takes it, but I just want to make you aware that you tend not to get those same problems with the doxycycline. All right. But in terms of minnow can be a good Bartonella killer, and as a tetracycline, it can kill babesia too. So, as many of you know, for our babesia treatments, we tend to use anti-malarial medicines because babesia is a parasite that acts and behaves a lot like malaria does. And it used to be one of the main treatments for malaria was doxycycline. There still are areas that if you want to go and use a preventive, if you're going into malaria endemic areas, that doxycycline still is one of the recommended drugs as a preventive going into some of these malaria areas. Okay. So I suspect that the striae and boils you're getting are part of a Herx reaction against Bartonella. Okay. And I suspect the increased sweats and air hunger is part of a Herx reaction for babesia. That air hunger sometimes can also be part of Bartonella too. Sometimes you'll get air hunger as you treat Bartonella and therefore as you Herx, all right? So it's not like you're getting a killing reaction. And so if it's too much, then you can decrease the amount of the minocycline that you're taking. So minnow comes as a 100 milligram pill, but comes as a 50 milligram pill. I think, though, if I'm right, I don't think it comes as a 25. So I think it's just a 50 milligram that it comes as. And so, but you could, in theory, be able to find a smaller dose of it, basically. Okay. All right. So, Damien, did that answer your question for you?
Yeah, that makes a lot of sense. I actually started tapering back to we got 50 milligram capsules, and it seems like I can only take it like every other day, and hopefully that's it's going to stay in my system, so that'll still be effective, not having to take it every day.
It should be. I mean, it's okay. It's okay to not dose every day, but to tailor it based on what your reaction is. It's okay to do that.
Excellent. Thank you.
All right. Good luck to you.
Thanks.
Hello, Diane. Let's see. Hi, Dr. Ross. Thanks for these informative webinars. You're welcome. Let's see. I have struggled with sleep since contracting Lyme back in 1989. I wake up many times during the night and have difficulty going back to sleep. I've taken many different sleep supplements over the years. What are your thoughts about having a sleep study? Have they ever helped your Lyme patients? So when people have sleep disturbances in tick-borne infections or chronic tick-borne infections, one of the driving factors often is that your sleep centers in the brain get disturbed by excess cytokines, okay? That probably is one of the lead reasons that people have insomnia. Now, that doesn't mean that lowering, and ultimately, getting your germs under control so they're not triggering the immune system to make cytokines is what's going to work, okay? However, you got to get there. And it's critical to get sleep because sleep also lowers cytokines. It's like this circle you just keep running around in, basically, all right? So there are some, when you're looking at sleep though, and if you've tried things and you're still not doing well, I think it's okay at some point in there to get a sleep study just to make sure we're not dealing with apnea that is keeping you awake. But it would be apnea as a separate problem. I don't think Lyme or tick-borne infections trigger apnea, but rather, people with tick-borne infections have other conditions as well too, right? So I'd say, yeah, if you're having a hard time, a sleep study can be useful. Also, in those sleep studies, they might determine if you've got something like restless legs, which is a need to keep moving your legs in the middle of the night that keeps some people up, and you can kind of see that on a sleep study as they watch how you sleep. They would be able to see that too if you're not aware of that. Okay. But in general, my approach to sleep is to take care of good sleep hygiene, and you're probably already doing this, but, no caffeine late in the day. Alcohol kills sleep, so don't do alcohol. And then try to keep your bedroom so it is for sleep only, maybe sexual activities, but keep your work and other parts of life out of the bedroom so that it is a place your body knows to go and relax and go to sleep. Okay. All right. And then keep your blue lights out of your bed too, and try to turn off your blue lights devices, meaning your cell phones, your computers, early in the evening, so you're not all stimulated by all of that blue light going to bed. Okay, so those are some of the basic sleep hygiene things. And then, but sometimes, if you sometimes do need to use prescription medicines in this illness, right? And usually where I like to start these days is a antidepressant medicine, which is called trazodone. It has no addictive potential to it, and seems to do a good job of helping people stay asleep. So it's usually useful for the people that can get out okay, but they're not staying asleep. And so trazodone is kind of one of my starting medications on that. So yeah, those are my thoughts for you on that. Yeah. Did it? Any other questions then?
No, that's very helpful. Thank you. I appreciate it.
Okay. Are you aware? I have a whole article about sleep hygiene or the basic steps and herbs and then the prescriptions. Have you taken a look at those too?
I found it. Yes, that's been great.
Okay.
I'm just trying to, my regular doc, I lost my Lyme doc because she's retiring, and my regular,
Yeah.
like I have a regular family care practice guy. He really wants me to have a sleep study done because I've struggled with this for years. And it just,
Yeah.
I mean, I had one done like in 2007, but it was unremarkable. The guy said, you definitely have a sleep disorder. It's none of the ones I know about, but yeah, I mean, he didn't know about the chronic tick-borne stuff. So,
Yeah. Oh, yeah. And the other thing, you're probably already doing this, but make sure you're doing things separate from germ killing to lower cytokines. So, curcumin, as many of you know, my main thing I like using to lower cytokines is to use curcumin. It's a derivative of turmeric or a part of turmeric. It gets inside white blood cells and blocks the production line. So at a minimum, try to use that to see if lowering cytokines makes a difference as well.
Yeah, I've been doing that. That's great. Thank you. I appreciate
You're welcome.
it.
Yeah. Good luck.
Thanks.
Let's see. Does anyone else have a comment or ideas there on that one?
I just have
see.
a quick question.
Oops. Who's talking? Oh, Emily is. Okay. Hi, Emily.
Sorry, I'm not fit for the camera.
No, it's okay. I was trying to. So what happens is that we got enough people that I have to look at two screens to see where people are, and I didn't see you light up there, but I see it now.
My apologies.
No problem.
I was just going to piggyback off the sleep disturbance thing because that has been a newer thing for me in the past few years. And but I notice though that if I sleep less, I'm usually in less pain the next day.
Yeah. No, sleep is with sleep you get lowered cytokines, number one, but also your nerves tend to be less irritable, and therefore you have better pain from that standpoint as well too. It's so with people with chronic pain, it's critical if they can get sleep. It can make a big difference in terms of the pain levels as well too.
Okay. Thank you.
Yeah, thanks for raising that. All right, let's see. Hi, Sandy. Let's see. Do you think it's okay to do the prolonged fast if I'm not overweight? I weigh 110, 5'7" tall, BMI of about 17. I'm afraid of losing too much weight, including muscle. What's your thoughts? Okay. So I would say, yes, it's okay to do it. You may lose about 2 to 3 pounds, but you can easily put that back on after the fast. The issue with the fast, again, the reason to do a prolonged fast is not about the weight loss. It's that when you do that kind of calorie restriction and limit yourself to a certain type of amino acids, fat, and sugars, that triggers the body to go into this fasting state, which then leads to autophagy, which restores and cleans up dead parts in your cells, helps get rid of these senescent cells, okay? And so those are great things that could benefit you as part of your chronic tick-borne infection treatment, all right? In terms of losing muscle, if you do the prolonged fast, the amount of amino acids they're giving you are meant to keep you from having muscle loss, all right? So the way the diet is put together, it's to protect your lean tissues, your muscle mass. So it would be mainly fat. I know you're already thin. You would lose that mainly. You're not going to be losing muscle mass on the prolonged diet, okay?
Okay, great. Yeah, that's what I was wanting to do, is just clean up the trash out of my body.
Yeah. And you know, I think it's probably a good idea if people can tolerate it, do it about once a quarter. Just go in, clean up the garbage that's left in your cells, the senescent cells. And, you know, and I know, yeah, you're losing 2 to 3 pounds on your frame. That would be quite a bit. I get that. But again, you can put that back on after the fast, after you've gotten the benefit of the autophagy and the senolytic effects as well, too.
Okay. Yeah. The main concern for me was losing the muscle.
Yeah, it's designed not to have you lose the muscle.
Okay. All right. Thank you.
You're welcome. All right. Let's see here. Hello, Teresa. Hi, Dr. Ross. I have neuroborreliosis for 5 years. I'm considering methylene blue. Any thoughts? Yeah. So methylene blue, I love methylene blue. I think it's dramatically changed treatments for both Bartonella and Borrelia, number one. I know it's a newer drug to many doctors. I haven't been treating people for over a year now, but I was using it for a couple of years before I stopped. Just saw some really good improvements out of it. So the reasons to use it, number one, it can kill, it's very fat soluble. It gets into the brain tissues really well. Okay, so it's an antibiotic that gets into the brain tissues. Number two, it's useful against treating both growing and hibernating or persister forms of Bartonella and Borrelia. So it can go after the growing state, and you know, we all get probably about 10 or 20% of our germs go into this hibernating state, and it is one of the rare drugs that can get at the hibernators too. The other reasons to look at using it is it is useful at patching dysfunctional mitochondria throughout your body and in the brain. So, you know, your mitochondria are your energy production systems in the body. And there is part of the way that the mitochondria make energy is a process called oxidative phosphorylation. It involves, in that process, it involves movement of electrons, and there's about 5 different protein complexes involved in moving those electrons so that you eventually get production of something called ATP. In this process, if you've got a lot of oxidative damage from having chronic infections, those oxidative agents can damage the first, second, and third complexes, making it so the electrons don't move. The methylene blue patches it. It actually carries the electrons from complex 1 and delivers them to complex 4 so that you actually get movement of electrons still, and you get improved mitochondrial function. And in fact, there's some studies in Alzheimer's disease showing good benefit by just using methylene blue for that as well too. Okay. So yeah, and the other thing, a couple other things from an not that you have Alzheimer's, just to be thorough, there's one of the things that oh, you do? Okay.
Well,
so the
I
other thing
have some decreased, you know, if the guy said I have age-related, I took all those neuro tests, and I've heard now that if somebody says age-related, find someone else, but
I got it.
Anyway.
Okay, so you have some dementia or some thinking problem. So so the thing is, it may help, you know, germ killing. It may help with improve mitochondrial function. In Alzheimer's specifically, we think that that one of the problems people is they develop impaired ability to make something called acetylcholine. And so if you can increase acetylcholine levels, that's helpful. And methylene blue has the ability to do that. It blocks an enzyme that destroys acetylcholine, so it helps elevate those acetylcholine levels. In fact, some of the prescription Alzheimer medications we're using these days are acetylcholinesterase inhibitors, blockers, and essentially methylene blue has some component to do that too. And then finally, methylene blue has the ability, is something called an MAO inhibitor as well too.
Yeah.
And it blocks an enzyme called the monoamine oxidase, whatever MAO means. And it blocks it, which leads to elevation in serotonin levels, which can help improve mood as well too. All right. So you get germ killing, improve mitochondrial function, maybe some increase in acetylcholine, so you get better thinking as a result of that too. And then it can help with some mood disturbances as well too.
My concern too is though, you hear it has to be USP grade, but you need a compounding pharmacy, otherwise it might be fake USP.
Yeah. I agree with all that. I agree. I mean, ideally, you want to see if you can get somebody to write you a prescription and send it to a compounding pharmacy.
I'm just trying to do that now.
Yeah, that's ideal. If you can't do the ideal, then the next thing is to work with whoever that vendor is that you're getting the methylene blue to see if they can send you their certificates that prove it doesn't have any toxins in it. Because that's the other thing, is there's heavy metal toxicity in a lot of this stuff you buy online. Because remember, keep in mind, methylene blue is available as a clothing dye. And so sometimes what these people are using is they're using the stuff designed for clothing dye, which is not cleaned up the way that we should have it be if you're going to be using it pharmaceutically.
Is it necessary too to have a G6PD test beforehand to know that?
I think it's a good idea. So you know about the mechanics of this. So if you do not, so G6PD, basic glucose 6-phosphate dehydrogenase, if you have insufficient levels of that and you take methylene blue, it could lead to hemolysis or rupture of your red blood vessels. And so I think it is a good idea to get that checked as well too before you start it.
Do you think the liquid, or I've noticed it comes in pills, powders, liquids?
It doesn't really matter. You'll find some people out there trying to advocate you should be a liposomal variety. Well, that's actually, excuse my language here, but that's garbage, because methylene blue is so well absorbed, so fat soluble, you don't need to mix it in a fat substance to get it absorbed. It's already going to be absorbed very well. All right. The other thing is, there's different amounts that some providers suggest. So for instance, Tom Moorcroft, who's a medical doctor that educates a lot of Lyme physicians, and he educates and has taught us all about methylene blue too. He advocates working towards 25 milligrams twice a day. I have found most benefit at 50 milligrams twice a day, and often, and not often, but sometimes running it up to 100 milligrams twice a day. Dr. Richard Horowitz, as part of his Dapsone methylene blue protocol, will use it even up to 600 milligrams a day, which I think is, anyhow. So I don't go that high. But okay, so he will use it up that high. So I just want we're still, I think, learning how to work. We don't have studies that tell us how it works on Lyme. We know from a laboratory that it does work on Lyme and Bartonella, but we don't have human studies. So we're all learning how to dose this based on our clinical experience. But usually 25 milligrams twice a day to 50 milligrams twice a day. The most common irritations you're going to find are it's going to stain everything blue. And so one of my patients discovered that if he uses a pumice stone, he can get his toilet cleaner than anything he's found. So just to let you know about that. Rarely it gives intestinal cramping or diarrhea. I've seen that happen rare. About 5% of people will get bladder irritation from it. And what can help calm that down is to take something called Pyridium. which you can find at the pharmacy over the counter as something you would use if you have bladder infections. That same medicine can sometimes calm that irritated bladder as well too.
Okay. Okay, great. Yeah.
All right. And I don't know if you've run into my article, but everything I just explained is in my article as well too.
Oh, what article is that? I might have missed that.
Yeah, let me show it to you here. I'll do a quick screen share here.
Thank you.
All right, let's see here. All right, so this is my information site, and then I have an article called "Mighty Methylene Blue for Tick-borne Infections and More," and it basically talks about what it does, talks about it can help with it goes through everything that it potentially can do is all listed in here basically, and I talk about how you would add it into a treatment as well too. Okay,
great.
Yeah.
Thank you so much. Yeah, thank you.
Yeah, we can stop sharing here. So I know methylene blue is something that has caught a lot of people's attention, so I'm wondering, does anyone else have a question? Jim, I see your hand up there. Jim, I think you need to unmute yourself there. Okay. So there you go. There you go. Okay. Yeah. Hi, Jim.
Thanks. Yeah, I had a couple of questions. In terms of dosage and all of those different actions that you talked about, would you are you thinking, for instance, that the higher doses are more for killing, and that the mitochondrial effect could be obtained with some of the lower doses, like Moorcroft is suggesting?
Yeah, I think you can get. I think the lower doses are enough to get the mitochondrial impact. I don't think you need to go up to the real high doses to get the mitochondrial impact. I do think that at all doses you get killing. It's just in my practice, I have found more benefit at the 50 milligram twice a day dosing in terms of germ killing benefit and improvements than I have found at the 25 milligram twice a day.
Okay, thank you.
You're welcome. Damien, I see your hand up there.
Just a quick question about methylene blue. Is that something that people typically stay on for months at a time, or is it treated differently?
Yeah. It's a good question. So, my standard with regular prescription antibiotics, not herbal antibiotics, but prescription antibiotics, is to rotate, try to change up what I have somebody on about every 6 months because I'm concerned of developing resistance. Okay. With herbal antibiotics, I tend to see less of a chance that you get the resistance developing. So I tend to run my herbals 9 months to a year sometimes before I switch. All right. Methylene blue, the way it's not 100% sure how it works, but we think the way that it works is it gets into the covering of the germ and destabilizes it. And so when a bacteria develops resistance to standard antibiotics, it's actually through a genetic and enzyme process inside of the germ that the germ develops ways of going around using enzymes in a genetic process. Okay. But methylene blue, because it literally is working within the covering of the germ to destabilize it, it doesn't appear that the germs have the ability to develop resistance to it in the traditional way that germs would develop resistance to antibiotics.
Interesting.
Yeah. So
Thanks.
I think the longest I had somebody on was about a year. I used it as long as we kept seeing benefits from it, basically.
Thank you.
You're welcome. Let's see. Does anyone else have a question there, or did we get through all those? Okay, good. All right. Karen says, I appreciate you too. Thank you, Karen. I appreciate that. We're going to have a mutual appreciation society here tonight. All right. Let's see. Hello, S. Who is S, by the way? S, can you tell me what your name is? S, are you still with us? well, I'll still answer your question in case you listen to it tomorrow then. So is magnesium L-theanate an acceptable for magnesium? I believe Gerald's brand offers it used for brain health. If not, can we double dose magnesium, the form you mentioned, and magnesium L-theanate together? All right, so, magnesium threonate is another salt form of magnesium. Where I'm familiar with it from is there's a protocol for Alzheimer's called the Bredesen protocol. Some of you may have heard of that. Dr. Bredesen basically, he's even recently published research on this, but basically he handles Alzheimer's and dementia as a comprehensive problem. He looks at toxicity, he looks at infections, he looks at lowering cytokines, he looks at your social setups. But one of the things that he has found beneficial is to work with magnesium threonate. All right. So if you're wondering what the Bredesen protocol is, just Google it. You'll find it. It almost looks like treating Lyme disease or the conditions we treat, because the way I treat, which is you got to deal with sleep, you got to deal with getting toxins out, you got to deal with your infections. I mean, that's the Bredesen protocol. That's exactly what he does. But one of the components of it is he thinks magnesium L-theanate is one of those things needed for better brain function. All right. Now, because it is part of his whole protocol, I can't break out whether what he's saying is correct or not, but I do know the research on his whole protocol shows benefit of approaching Alzheimer's as this comprehensive illness where you need to look at many different things. All right. So I believe Thorne Research offers magnesium L-theanate. The problem I have with Jaro, you can do it, is there's a quality difference. That's what I'll say. Jaro, I don't think it has some of the strongest quality, but if you could find a Thorne, I think that would be a good idea. And can you mix them together, different salt forms together? Absolutely. I have no problem with people doing that. Okay. So Ested, yeah.
Thank you, Dr. Ross. I'm sorry, I was muted and I didn't realize that.
So what's your name? What does S stand for? Oh, I think we just lost you.
My name is Sundaria.
Okay. Oh, okay. I recognize you from. I think I've written some responses to you. Am I correct about that?
Yes, sir.
Okay, that's you. Okay, nice to hear your voice.
Thank you. Thank you for all you do.
You're welcome. All right. Hello, Corey. Let's see. Hi, Dr. Ross. This is my first time on the webinar, but I have been watching them and find them very helpful. I have been treating Lyme for 6 months now. My doctor retested me using the phage test from Red Labs in Belgium. It came back positive for Borrelia miyamotoi. I am currently on minocycline, azithromycin, cryptolepis, and natokinase. I was wondering your thoughts on Borrelia miyamotoi and if you think this is a good treatment for this strain in particular. Yeah. All right. So Borrelia miyamotoi is a type of Borrelia called gives you something called relapsing fever. Okay. And the other lab that can test for those or tick-borne relapsing fever, TBRF, tick-borne relapsing fever. There is some science that says that tick-borne relapsing fever can also create chronic illnesses as well too. And because it is a type of Borrelia, what we mostly use are the same things we would use against chronic Lyme Borrelia as well too. So yeah, amino azithromycin, crypto, natokinase, I think could be something that could work well for that. Okay. The truth is, I don't think we have as much experience working with, we as Lyme literate naturopaths and Lyme literate medical doctors don't have quite as much experience working with the miyamotoi and the tick-borne relapsing fevers to know, do they go chronic as much as chronic Lyme disease does, for instance, okay? But we do pursue treatment for those. And usually it's using the same concepts we would use for Lyme borreliosis as well, all right? And then let me just talk briefly about this phage test from Red Lab. So every bacteria that infects our body there are various viruses that will come along with those bacteria. All right. So if we get a certain bacteria in us, there's viruses that basically invade our body. They don't hurt us, but their job is to try to control that bacteria. And so one way that you can determine if you have living bacteria in you, a certain kind, is to see if the phages, these phage viruses that would come along with them, are present. Okay. And so that's what Red Labs is doing with their phage test. Now, they do have some good science showing that when it's positive, it really does mean you have the bacteria. They've done validation studies on that. What we don't know from any of their studies, though, is how good are they at picking it up when it's there. Okay, that's called sensitivity. They haven't done sensitivity studies so that we really know how accurate is it at finding it. All right. But yeah, I think since it came back positive, that's a valid test. And the approach you're doing seems like a reasonable approach to me.
Just wanted to
Corey,
say thank you.
Yeah. Say that again. I'm sorry.
Oh, I just wanted to say thank you.
You're welcome.
I haven't heard much about Borrelia miyamotoi. So it kind of like worried me when I got that test result back.
Yeah, it's a tick-borne relapsing fever. There's some thought that for people that have a lot of Borrelia symptoms, the joint aching, the thinking problems, the fatigue, the muscle aching, and they come up negative, that maybe a lot of that is the tick-borne relapsing fever varieties. There's a wondering that we have. I don't think we have good science to prove that for sure.
Thank you.
You're welcome. Good luck. All right, let's see here. Hello, Cheryl. Let's see. I'm still trying to figure out if I'm having a Herx or reaction to Pseudoacuta. I thought it was probably a reaction. I'm now wondering if it is a Herx. How long would a Herx last? It's been 8 days since I tried it again. I contacted my tick doctor, and she thinks I may have developed at least a component of mast cell activation, which could be from Bartonella or mold. So far, I have little improvement. Any thoughts? Thanks for your help. So, so to answer one part of your question, a Herx is typically going to last maybe a week or two. So you take something, you get worse, it's a Herx. If it's a Herx, that's because your immune system sees these dead bug parts and makes more cytokines. That kind of a reactive phase usually is about a week or two. If it's going on longer than that, it's something else. It's either you have poor germ control and your germs are just, they're growing a lot and they're triggering more cytokines, or it's that you're having side effects from it. Okay. In terms of whether you have mast cell activation, I mean, it's possible, but literally for me to help figure that, I would have to spend almost the equivalent of a visit trying to figure out, because there's not an easy test for that as well too. I know you're working with an experienced doc. I mean, I know your resources are tight too, but you may just need to go back in and see her again to see if she can give you some input as to what's the best way to go here. Yeah. Cheryl, did you have any comment there at all? Oops, I'm not hearing you there. And see, your mute's still on, it looks like. You're still muted. Yeah, you can't get it unmuted. Sorry. Oh, there you are. You're unmuted now.
Finally, I don't know how to work this thing. But yeah, thank you. I'm just trying to figure it out. I'm going slow and seeing how I react and stuff, and keeping in contact with her. But I kind of wonder if it's a Herx.
I mean, usually, again, a Herx is going to be something that happens right after you start something, but usually it's time limited. If the type of and the other thing about a Herx is it's not new symptoms, it's a worsening of your existing symptoms, because your existing symptoms are cytokine related. All these excess cytokines your immune system makes are what give you most of what we call Lyme, Bartonella, Babesia symptoms. And so therefore your underlying symptoms would get worse as part of a Herx. But if you got like a new situation, a new symptom coming in as you're using it, that's a side effect. That is not what I would call a Herx reaction.
Okay, because the pressure in the head and like the pulsing, that is new, but that quivering, that I've had that.
Yeah. But because of the new symptoms, if I was treating you, I would probably just pull you off the Senolytic and say, I think it's a side effect.
Yeah. Yeah, I'm not going to take that anymore. And I hope I get back to where I was. And I have had a little improvement. I'm just hoping it keeps up.
Good. Oh, the other thing I'd say too, I mean, this is the most frustrating thing about tick-borne infections is when the hell am I going to get better? I mean, you could be on an effective treatment and you may still not see the improvements. Okay. So let me say a few more things about that. So for Borrelia, there's a group called LymeDisease.org that has a project called My Lyme Data, where people that have Lyme disease are enrolled and they get a big questionnaire they have to fill out. And then periodically with this My Lyme Data, they'll send out another questionnaire to get answers to some other question they're trying to figure out. Okay. So I think about 3 or 4 years ago, they sent out a questionnaire trying to find out what it is that got people well. And there are a few things. Number one, a year or more of antibiotics. That was one of the findings, okay? Number two, working with a Lyme literate medical doctor that can help weave through all of this stuff, okay? And then number three, using antibiotics. Now, they didn't break out what happens when people do herbal antibiotics, but just the idea, use antibiotics, use them long enough, and then working with a Lyme literate medical doctor, right? Now, what I can tell you is there's an unpublished study that looked at how quickly do people turn around when they're on a Borrelia treatment, so a Lyme germ treatment, all right? And what that study showed, and this was presented at the annual ILADS meeting, maybe about 12 or 13 years ago. This was way back when. And what they did is everyone that had Borrelia in this study were put on clarithromycin and Flagyl. All right, we didn't know about persisters back then. And so clarithromycin would treat spirochete growing and intracellular growing, okay? And then the Flagyl metronidazole would treat the cyst form of the germ, okay? And so in that study, by 3 months, 30% of people started to have some improvement, which means by 3 months, 70% had absolutely no improvements, okay? All right. By 6 months, 60% of people started improving, which means by 6 months, 40% had no improvements. And by 9 months, 90% of people started improving. That didn't mean they were all the way well. It means they started to improve, okay? And then there's that 10% group that seems to take longer. So sometimes it's just a matter of sticking with it and persisting through it, basically, okay? Yeah, and then on Babesia and Bartonella, my observation is about 85% of people with Bartonella will basically be over their Bartonella in about 4 to 6 months, and 85% of Babesia people will be over their treatment in about 4 to 5 months. But there's that 15% core of both Bartonella and Babesia. It's just going to be an ongoing 1 to 2 years of treating as well, too.
Okay.
So patience is the big thing here, unfortunately.
Yeah. Yes.
Hang in there. All right.
Yes. Thank you.
You're welcome. Did anyone else have a comment there at all? Jim, go ahead.
Yes, I had a question going back to the beginning of this answer to Cheryl regarding Herx, that it goes away subsides after 2 weeks. If the killing is still going on, what do you think is the mechanism that causes that to subside?
So usually what happens is when you first start, you introduce something new, you get a huge killing. So you get all this excess cytokines, right? But at a point, you still have killing, but it is more of a balanced amount of killing. So you're not dumping a bunch of excessive cytokines into the mix. And that seems to be about 1 or 2 weeks that you get this excessive cytokine dump whenever you introduce something new or increase the dose of something.
Mm-hmm. And if you were to switch between two things that both work, would you expect to hurt just because it's new?
You might. Often what happens though is as you are further in treatment, as you've decreased your germ load, there's not as much to kill. And so if you introduce something new or change to something that hasn't been used for a while, you're at a different starting point with your germ load. So often as things progress, even when you put something new in, you're not going to get the intensity of the Herx that you did at the beginning, for instance.
That makes perfect sense. Thank you.
Yeah, you're welcome. All right. Good luck to you, Cheryl.
Thank you.
You're welcome. Let's see. Hello, as again. Let's see. Hi, Dr. Ross. Thank you for all your insights. Can you take ivermectin and methylene blue together? Thanks. I don't see any reason you can't. Again, I'm skeptical of ivermectin. I just want to let you know. So regarding ivermectin, especially in the pandemic, everyone started thinking it could kill every germ possible, and I just don't see it that way. Regarding Borrelia infections, there is no evidence that it kills Borrelia. There hasn't even been any studies done, okay? However, I admit that some of my patients on ivermectin feel better, but ivermectin is a very strong cytokine regulator. And I think that may be what's going on. In terms of mode of action, I don't see how it would treat Borrelia. Ivermectin has some studies showing that it may have some benefit in Babesia. When I've used it or had people on it before in Babesia, I don't find it to be the strongest way of going after Babesia. And there are no studies that says it does anything for Bartonella. So it isn't something I would use for tick-borne infections. Regarding COVID, there's a lot of controversy there, and it depends on whose studies you're looking at and whether they were biased in what they did with their research and how they published it or not. But on the whole, as I look at it, I don't see the role for it in acute COVID. I do think it may have a role in long haul COVID, and that is it may have the ability to attach to the spike protein and help result in clearing of those spike proteins that keep some people with long COVID ill. But that's about the only role I see for it. I do see a role for it in certain parasites that are known, that for which it is known to be effective against, okay? But if you, for whatever purpose you're using it, yeah, it can be used with methylene blue. I don't see a problem with that. Did that answer your question okay? Yeah.
Yeah. So in my case, I know, so I became symptomatic 10 days post taking COVID vaccine, dose 1.
Yeah.
Yeah. And I did not have a Lyme or any autoimmune diagnosis prior to taking the vaccine. So I mean, at the time, there was no protocol in place to really understand what was going on. So at the time, who came to my rescue was an LMD who ran other tests, and I was under her care for about 2 years, taking different antibiotics while I did feel better at the time. And as we were trying to progress on different protocols, trying different antibiotics, I was on rifabutin. That's when I couldn't tolerate when my capsules or when my pills jumped from 1 to 4. 1 to 4 pills a day. That's when I started seeing some side effects and I had to discontinue the protocol. At that time, I was also taking azithromycin, dapsone, rifabutin, and methylene blue all together. So I don't know if it was just rifabutin that was causing the issue, or rifabutin and methylene blue, but I have read that there can be some discoloration taking methylene blue. I'm kind of assuming that could be on the skin on an external level. But what happened to me was I developed pigmentation on the inside. I mean, so there was discoloration all over my body, my face and everything. So my color changed, my skin color changed. So
on the but were you on a tetracycline at the same time?
No, doctor, I was not.
Okay, just wanted to clarify that. I haven't seen anyone develop, and I've used quite a bit of methylene blue. I'm not denying what you're saying. I haven't seen anyone have coloration issues from being on methylene blue before.
Could rifabutin cause it? Because my LMD was of the opinion that rifabutin was susceptible to causing discoloration. So I don't know. No, okay.
I think I've seen some reports, and I'm remembering off the top of my head, so I would have to look back into this before again. But I think rifabutin can sometimes, or the rifamycin, rifampin, rifabutin can lead to some skin coloration issues. But I'm not solid on that idea. But I think I've seen something on that before.
Okay, so while on those antibiotics, I was definitely losing a lot of weight. And of course, it changed with my skin condition. So I did pause it for a while, and I was looking into other herbal antibiotics to kind of, see if that would help. And that's when I met cellular health doctor who kind of treats COVID long haulers or COVID vaccine injured in a manner that is similar to the COVID long haulers. And I've been on Peter McConnor, his protocol of spike protein thing. So I'm not really sure what caused my symptoms, but my biggest concern has been neuropathy, and small fiber neuropathy is my biggest concern. I know you did speak about Herxheimer, so I have a question on that. So when I was taking herbal antibiotics, I did see that my symptoms, which is mainly on my spine and between the shoulder blades, it's paresthesia or small fiber neuropathy caused by a lot of pain, and also on my scalp, on my head. So it was localized to the thoracic area, but then when I was taking herbal antibiotics, it kind of progressed to the lower part of my spine as well as the sides. So would you consider this a progression of the disease while taking herbal antibiotics, or is it a Herx reaction?
So if it started within, say, a week of beginning the herbal antibiotics, I would probably call it a Herx.
Okay.
Or if you started slow on your herbs, but you increase and there was a dose at which it started, then I would probably call that a Herx.
Okay. Okay, thank you.
All right. Good luck to you. Let's see. Oh, okay. So Joel's got two parts of the question here. So first part is, my husband is recovering from Borrelia and Bart on your protocol. One problem now is an itchy rash on his arms and legs. Any suggestion with this? So Joel, just a quick question, if you could answer for me. Is it a rash that you can physically see with your eyes, or does he just have itching and you're calling that a rash? Joel, are you still here? Yeah. Joel, if you could unmute your microphone, because I need to know whether you're seeing a rash or whether it's just itching that you're having there. All right. Well, I don't see you doing that. So I'm just going to make a quick comment. So itching, if there's not a rash, if there isn't something physically you can see, itching could be something called neurodermatitis, which is your nerves, sometimes when they get inflamed or injured, release chemicals that give you a lot of itching. Okay. So I want to just kind of keep that one in mind. And so depending on whether there's a rash there or not would depend on how I would say to manage it. If it's no rash there and it's just itching, then I would say that you could use herbs like L-theanine to control the neurodermatitis. Now, L-theanine 100 milligrams. L-theanine leads to increased GABA levels, and if you use GABA, that can calm agitated nerves. And so you do 100 milligrams 3 times a day, working up to 300 to 400 milligrams. All right. If there is an actual rash there, then I would need to know what it looks like to figure out what is the best way to approach that. Is a fungal infection? What exactly is happening? So I don't have enough information to answer that for you here. Okay. Let's see here. All right. Hello, Dan. Let's see. Thank you for your guidance, helping us getting back to good health. You're welcome. How long do you recommend staying on naltrexone? I have been taking for approximately 6 months recently. I wake up with headaches. I'm pretty sure it's from the low dose naltrexone. When I miss a night of taking no headache. So if naltrexone is going to help you, you should know if you've had a difference from being on it by 6 months. If you're not seeing any benefits in anything with your health by 6 months, I would go ahead and stop it. Okay. Secondly, if it is a side effect, sometimes reducing the dose. So if you have worked up to 4.5 milligrams, you may find you could tolerate 3 milligrams, for instance, or even 1.5 milligrams. All right. So it may be a trick of you. If you have gotten benefit, it may be a trick of finding a dose that you can tolerate that doesn't give you the side effect, basically. Okay. Dan, did you have any other question there?
Dr. Ross, thank you. No, I couldn't tolerate 4 milligrams. Three worked. Sorry about the darkness here, but 3 milligrams worked. But then recently, just about 2 weeks ago, I'm like, wow, I wake up, I just can't shake this headache off. So I'm like, what the hell is going on here? So when I would miss a night, I'd wake up and I don't have that headache in the morning. That's got to be the LDN. Because other than that, you know, I've been on Japanese knotweed, Creptolyptus, like the last, 5, 6, 7 weeks, I've been really feeling pretty darn good, with the Capri Plus, because I had a yeast overgrowth. So I've been committed to all those things. So that's just what I'm thinking.
Yeah, I don't know why you would have suddenly developed sensitivity, but it does sound like a sensitivity to me. I would still see if maybe you could go down to 2 milligrams, and if you've been on 3, see if there's a dose. But sometimes the longer we take things, we can develop sensitivities to them, and just maybe something you're not going to be able to use. But I would still see if you can find a dose that you can tolerate, though.
How long do some of your patients normally stay on LDN? A year?
So, well, I mean, at a minimum, I like people to try it for 6 months to see if they're going to get benefit, because it can take that long to see if you're going to get benefit. Mm-hmm. And if they are getting benefit, usually we'll leave them. I've had people stay on it indefinitely, like year, 2 years, as long as we're still seeing improvement as part of as something they're using within their protocol and they're getting improvement, right? But at a point, I will start withdrawing things from treatments and see, do they still need it or not? But I've had people on it for a year, 2 years. If they have a lot of autoimmune stuff, even after we clear the infections, I sometimes would just leave them on it permanently.
Got it. Okay. And also thank you for opening up your supplement store. It's great. Thank you.
You're
for
welcome.
making
I appreciate that.
Yep. It's great.
Thank you.
Thanks for all your guidance. I really appreciate it.
Appreciate your comments too.
You bet.
Tracy, I see your hand up there. I'm going to see you. Tracy, did you have some comment there?
Let's see. Yeah.
Hi, Tracy.
Hi. I was just going to say that there is kind of piggybacking on what you said. There's a pain specialist named Norman Marcus who works a ton with LDN, and he's in his research has found that often the sweet spot for people is between 1.5 and 3 milligrams, at least for pain. And sometimes people overshoot it, and so that's why he likes people to go very, very slow. And he recommends, like you, like sometimes what you need to do is actually go backwards. You might have might be taking too much. So
I know my standard recommendation is to try to get up to 4.5 milligrams, but I one time had a person we started at 1.5, terrible she had a lot of side effects. I wound up being able to manage her at 0.5 milligrams a day, and she got benefit from it. And so, yeah, it's one of those things you have to individualize, I think, the dosing that you're using. And I appreciate your comment that he's thinking more of a mid range. Well, I have found most of my patients with chronic Lyme will tolerate up to the 4.5 milligrams. They can do the 4.5, but not everyone. Not everyone can.
Yeah, he's mostly treating like Ehlers-Danlos syndrome and chronic pain. So yeah, that's his population, and that's kind of what he's found with that population. So
got it. Thanks. I appreciate your comment. Yeah.
Hi, Dr. Ross. This is Caroline. How are you?
Yeah. Hi, Caroline.
I just thought I'd add to that. I had gotten headaches with the low dose naltrexone too, but I noticed I was dehydrated at night, and you really can't mix it with other meds.
Yeah.
So I was taking a low dose statin at night, and I was definitely getting headaches with that too, with the load. So like mixing, I found I tolerated better with food. So just wanted to add that. So thanks.
Yeah. Thanks. So Dan, you may want to play around with some of those ideas as well too.
Yeah. So what I normally do at night, I take it with magnesium when I go to bed. So maybe I'll take it separate, or take the magnesium later or earlier.
Yeah.
Great advice. Thanks.
Thank you. All right. Let's see here.
Dr.
Jim
Ross,
says,
I'm sorry, do you mind if I ask you a question about the cytokines real quick?
Sure, go ahead.
Okay. You mentioned the curcumin. Which version of that do you like? And I had read something about curcumin oil being very potent. What do you like?
So the issue with curcumin is getting absorption. And so you need to have it, there's a number of ways you can increase absorption, but one is to have it turned into, use like a liposomal variety of it. And so the product I like is a product called curcumin phytosome, meaning it's a liposomal form, and it's by Thorne. It's 500 milligrams 3 times a day. That tends to be the one that I like using. Did that answer your question? All right.
Thank you so
Jim
much.
said, you're welcome. Jim says, when do you use H2 absorbed by research nutritionals? I don't. Now, I know I offered it at my store, and the reason is I happen to carry the whole line of research nutritionals because I've found a lot of people like using it. So basically, it's supposed to help absorb, what does it do specifically? I think it helps absorb a lot of your excess oxidation agents. I think I have found good benefit using glutathione as an antioxidant, and so I use that regularly. So I just haven't turned to using the H2 absorb. I know that may not be a good answer there, Jim, but I just don't have experience using it, basically.
Thank you. I was kind of surprised because for a while you only had a selection of their products. Is that right?
For a while, what now?
For a while, you did not have their whole line.
No, I've actually had I've been carrying all their products for probably about, maybe about 8 years now. And the reason is I was one of the few people offering it online, their products online. And I had a lot of requests from people saying that weren't necessarily my patients or even had Lyme disease that knew I carried all of most research nutritionals. And I started getting a request that I carry that one. So I carry it for that reason. It isn't something that I had used in my practice before, though.
Thank you.
You're welcome. Hello, Marge. Let's see. Hi, Dr. Ross. Any suggestions on what type of antibiotics I should take for eye pain? So first of all, for eye pain, don't assume it's necessarily from tick-borne infections. And so as a baseline, I would make sure that you had an eye exam by either an ophthalmologist or an optometrist that can look at the anatomical structures of the eye, the muscles, the nerves, etc., and make sure they're not seeing anything damaged there. Okay. So I hope that you've done that. I think you had written to me about this before, and I said, get a good eye exam. All right. And I still stand by that. In terms of what if you had an eye exam and they're not seeing anything abnormal on their exam, meaning they don't see that you've got problems with the muscles or whatever, then usually what eye pain is more muscular of the muscles around the eyes, which could either be Borrelia, maybe Bartonella, but there isn't any one antibiotic that I would say is going to target eye pain. It's the general treatment you're going to do using an antibiotic combination that's going to treat your tick-borne infections correctly. Okay, so there isn't, I wouldn't say use minnow for eye pain, or I wouldn't say use Japanese knotweed for eye pain. What I would say is treat the infections you have that might be leading to eye pain, but definitely get that eye exam done first. Marge, did you have any other comment there? All right. Hello, let's see us again. Let's see. Thank you for your insights. I've been sick for the last 4 years. I became sick 10 days post-COVID. Let's see here. You know what? Hold on. So we've only got 5 minutes left, and I'm trying to decide if this is going to be too involved. Let me read it here real quick. Let's see. Thank you for your insights. I've been sick for the last 4 years. I became sick 10 days post-COVID. I was diagnosed with Lyme, relapsing fever post or RF post-vaccine. I was on antibiotics for 2 years for Lyme. However, all my symptoms relapsed 2 weeks post-pausing protocol due to side effects from antibiotics, especially the rifabutin. I later saw a functional doc who works on cellular health. This doctor has started phosphatidylcholine intravenous infusion. My question is, I have had a lab work done by an LLMD, not under care now, sometime back, and a blood showed high abnormal antithrombin activity, fibrinogen activity, D-dimer, plasminogen, ferritin, vasculitis profile, fibrinogen, antigen, lipoprotein, C-reactive protein, cardiac D-dimer, prothrombin fragments, etc., with high parameters for coagulation. Is it safe to take phosphatidylcholine supplements or intravenous infusions? I also take, So I don't see, so yes, you've got increased you've got a coagulopathy going on. And that coagulopathy could either be caused by the vaccine that you had. Also, tick-borne infections sometimes can lead to coagulopathies as well, too. One of the things I like doing in these situations is to work with lumbar kinase. Lumbar kinase helps clear a lot of the fibrin and all that helps break down the blood clotting proteins. A lumbar kinase 20 milligrams once or twice a day. Some practitioners would even do injectable heparin in a situation like this because it is fibrinolytic, but also will do some blood thinning. Because part of the problem you run into when you have some of this well, anyhow, those are some thoughts for you to consider there, okay? But in terms of doing phosphatidylcholine along with ivermectin and the other problems you have, I don't see a problem with doing that.
Okay, thank you. Thank you so much, Dr. Marty Ross. And
you're welcome.
I have been taking nattokinase as a part of the COVID protocol. Will that be okay? Or should I combine?
Yeah, you know, so one of our colleagues that has done a lot of looking into the various types of enzyme fibrinolytics, and so looking at lumbar kinase versus nattokinase versus serrapeptase, is Dr. Harry Lidner. He's done a lot of work on Babesia. I actually had a talk with him at the last ILADS conference here talked to him maybe 2 or 3 weeks ago at the ILADS conference. And, you know, he had presented some information on one of his talks to us that showed, as I remembered it, that lumbar kinase was about 100 times more potent than nattokinase. And I was talking with him about that because I haven't been able to find that data anywhere. So I was asking him about his data. And what he told me is he actually, and the reason he was using it is his daughter was really infested badly with Babesia. She eventually passed away from it. But he was trying to do anything he could to clear up these fibrin nests that hold Babesia together. And he went into it originally just working with lumbar kinase, But what he started noticing is that, yes, there is a degree of difference, although he doesn't stand by the 100 times different anymore. He's not sure anymore in real world experience. He found benefit, at least breaking up these fibrin nests, of using both together. He got most improvements when he was using the two together. So they might complement each other. So I think probably my experience is that maybe the natto is a little bit weaker, but if that's what you could tolerate, fine. But you might experiment with even adding Lubro on top of that.
That's awesome to know. Could it be taken at the same time, or one in the morning and the other at night?
Either way, you could do them both at the same time, or you could split dose it.
That's awesome to know. Thank you so much. And with reference to the methylene blue, taking along with ivermectin, is that supposed to help with BART? Because I was told I have BART as well. Bartonella.
So what would help BART? Tell me that again. I missed part of that question.
Methylene blue.
Oh, yeah, methylene blue is very useful against growing and persister Borrelia and growing and persister Bartonella. It does both.
Okay, so I can take that with ivermectin.
Yeah, I see no problem with that.
Okay, thank you so much. Thank you so much, Dr. Ross.
Yep, good luck.
Thank you. Appreciate it. Thank you so much.
You're welcome. All right, everyone. Let's see here. So I'll just do this one real quickly, even though we're at the end, but I'll take it anyhow. So Jim wants to know what symptoms would lead to order a SIBO breath test. All right. So small intestine bacterial overgrowth usually will give you a lot of bloating and gassiness almost immediately on eating. You'll just balloon up. You'll eat, and maybe within the next 15 minutes or so, you'll start to just balloon up in your belly. If that happens, that I would think of ordering a SIBO breath test then. The other situation I would do it in is if I've got somebody with a lot of intestinal gassiness and bloating that doesn't come on right away after they eat, and they've tried treating for yeast and that is not resolving within 4 weeks to 8 weeks, then I might come back and test for SIBO under the possibility that it could be SIBO, giving a lot of that gassiness and bloating.
Thanks. I just wanted to share the reason I asked this question is I don't suffer from those symptoms.
Yeah.
But, I've recently enrolled in this new program at Mount Sinai in New York, and that was just one of the tests that they asked me to obtain on my own.
Yeah.
And the other
is this the new Lyme clinic at Mount Sinai? Oh, exactly. Interesting. Yeah. Yeah. Okay.
And it's not just Lyme; it's also long COVID and so forth.
Yeah. Yeah.
And just for, because I think it may be of interest to you and others. They also asked for fibrinogen, and one of their research interests is using lumbrokinase for. They're not talking about fibrin nests. In fact, they don't really talk about directly treating the infection because they're the physical medicine department, rehabilitation.
Right.
But the microclotting.
Yeah.
Lumbro. So that's one of their studies.
Yeah. Yeah. So interesting. So yeah, the Lumbro, we were just talking about that. natto is another option on that too. But yeah. Great. Thanks for bringing that up. All right.
Thank you.
All right, everyone. Great visiting with you. Thanks for putting up with my camper van in the background there. And I hope to roll into Austin sometime tomorrow afternoon. I'm going to go back on the road here for about another 3 hours and then pull in and go to sleep. But so in the morning when I get up, I will put together the video and the synopsis and get that posted up for you all so you can take a look at that again. All right. And then I hope you'll sign up RSVP for next week. All right.
Thank you so
Goodbye,
much.
Everyone.
Good night.
You're welcome. Good night, everyone.